Yeah, diolch. Thanks for the invitation. So, yes, Maria said, so I'm a psychiatrist and also I'm a researcher here at the Wolfson Centre. Sort of work in CAMS in Cwmtaf Morgannwg Health Board, and also with a psychiatry service here in Cardiff University. Some of you might have seen this or version of this talk before. I've been presenting it to different groups over the past year or so. So it's about this project called the Digital Support for Young People with their Mood and Wellbeing study. And it revolves around this program called MoodHWB, or MoodHWB in Welsh. Just to give a bit of background, so we know that low mood and depression are common in young people, but many aren't getting any help. And digital or online programs have been of increasing interest and can reach people at relatively low cost, especially compared to face-to-face therapies. But I'm not to say that this is to replace face-to-face, but as one option, and also could be used as an adjunct. So MoodHWB is something we've developed over the last few years with young people, parents, carers, and professionals. It's a fully bilingual program, both a website and an app. Its main aims are to promote self-help, help seeking where appropriate, and also social support for young people. It was developed with young people aged 12, 13 up to 19, and we're doing a trial now of it across Wales and in Scotland as well, with that age group. We're also developed it for parents, carers, friends, and practitioners as well. And although it was developed initially primarily as a sort of psychoeducational program, so that means sort of full of healthcare information, it's become more therapeutic with aspects of cognitive behavioral therapy, interpersonal approaches, positive psychology, but again, a big emphasis on social support for the young person. And the origins started many years ago now. It was on the back of youth mental health studies here at Cardiff University. So, for example, the EPAD, or Early Prediction of Adolescent Depression study, where we followed over 300 parents with depression and their adolescent offspring, and looked at associations in terms of mental health difficulties and so forth across 4 waves in total. But many of the families and carers and young people as well were asking for resources and interventions to help them. We also worked with youth advisory groups from the start, including the Alpha group from Decipher. And we've also been influenced by digital health researchers, including those in New Zealand who developed Sparks for a gamified program for depression young people, and also colleagues here in Cardiff University who've worked with to develop programs, for example, for bipolar in adults. And I have a background, as well as in medicine, I have a background in illustration and animation, and it was just a way of bringing everything together, especially interested in how it was possible to convey subjective experiences and mental health difficulties through visual and other means. Sorry, it's a busy slide, but it's just to show the overall model we followed for the development of MoodHWB, and show that it was done in a thorough way, and also it's a model that other people can follow if they're developing digital programs. It's been published as part of a review of co-design of digital mental health technologies. So in the green box there, we did a systematic review of psychoeducational interventions for adolescent depression, but also looked at other approaches for young people, including digital approaches more broadly. And then in the yellow boxes, the orange boxes, this was the probably most important phase, the co-development phase, which consisted of a discovery phase, and that was a series of interviews with young people, parents, carers, and professionals to generate the initial ideas for the program. And then the co-design phase, which was a series of focus groups and workshops with these groups. So we held these here, most of them here at Cardiff University, with this kind of layout where we had young people around a table reflecting on questions and initial designs on the screen, and then they could discuss or draw different ideas, and we recorded everything and analysed that. And on the left there's an information sheet we developed for these sessions. And you can see we went from initial drawings and sketches and post-it notes through to the wireframes or overall structure and process for the program, and then the black and white and color screens. And this was all published in a paper, and I've had people approach me to say they followed a similar approach from reading that paper for their own apps and websites for mental health difficulties. So finally, we did an early evaluation that's in the purple box, and that was, we asked young people in South and West Wales whether they would like to use this program for a couple of months. We recruited from schools, mental health services, and the previous study sample, and asked them to complete questionnaires at the start and at the end. We interviewed some of them as well, and you can see some of the quotes here from the interviews. And over 40 young people and 30 parents and carers took part. We did a focus group as well with professionals, and we monitored web usage and wrote it up as well. So as you can see, we got lots of favourable feedback, but also lots of constructive feedback on how to improve the website and the programme more generally. And all of this was part of my doctoral fellowship. And then I'm on a second fellowship now, and the early part of that fellowship funded by the Welsh Government was to improve the programme based on feedback from this early evaluation. So this is what the programme looks like now, after working with young people, but also with schools and mental health services and charities to make sure that it's appropriate for those settings where difficulties can start. And there were some changes, including increasing the self-help content. We made it more of an app as well as a website, so it's a fully functioning app. I'm showing the Apple Store and Google Play icons there, so it is registered there, but you can only access the program if you're part of the current research, but you can actually download the icon onto your phone. We also made it more about symptoms. So the earlier version was a bit more about depression and the diagnosis. So we focused more on symptoms and low mood and anxiety in particular. And we made it all more user-friendly, developed new content. I have an animation, hopefully it works. And this is the animation that young people can see if they log into the program, and gives an overall idea of the program, but also the tone of the character design and so forth.
It's normal for young people to feel down and not enjoy things sometimes. If these feelings are long-lasting or keep coming back and begin to affect day-to-day life, this could be a sign they need some help, either by finding ways to help themselves or by getting help from others. Low mood and anxiety often happen together and can affect people of any age. It is common for young people to experience these difficulties.
This program can be used as a website or an app. It is for young people and for families, carers, friends and professionals who would like to know more about low mood, anxiety, depression and other health difficulties. It also has advice on self-help, ways of staying well and where to get help.
You might use it because you're having difficulties. For example, if you're feeling down, worried or stressed. It's possible that you only have some difficulties, or that you have many which are affecting your life a lot. You may have been given a diagnosis of depression or anxiety. Or maybe you're worried you might have difficulties in the future. For example, if someone in your family has had problems with low mood, anxiety or depression, or if you're under a lot of stress. Or it might be used by a family member, carer, friend or professional who is worried about a young person.
This program has been developed from talking to lots of young people, including many who have had difficulties, as well as families, professionals and designers. It's also based on the best research available and is supported by many organisations.
It's been built so that it's safe, secure, private and confidential. There are various options to help personalise it. You might like to use it on your own or with someone you trust. You can choose the language, and the hide button can be used to leave quickly at any time. Answering the questions at the start helps to find the sections that are most relevant for you and helps you to notice how you're feeling, so you know when you might need to do something differently or when to ask someone else for help. It's also possible to skip the questions and just browse. All information you put into the program will only be seen by you, although you might like to show it to someone you trust.
So yeah, that gives an idea of the program, but also we did a lot of work with young people on the character design and the color schemes and so forth. And as well as the sections within the program, there's a mood diary and goal setting section, and also useful links. So the mood diary has proven to be pretty popular with young people, something you can track on your phone. And the goal setting section is something where you can plan activities, one-off or regular activities. And this could be maybe in conjunction with a counsellor if you're seeing someone, and then you can review things afterwards. And the useful links is where you save links to helpful resources. Maybe it's a video or something. And each section follows a similar structure. So you can go into, this is the introductory section. You can see a progress bar at the top. You can jump to any subsection, and the starred subsections are those that are most relevant to you based on the answers you gave in the mood diary. So it's full of animations, text, interactive sections at the bottom of the screens. So that includes quizzes, questions about yourself, personal stories, links to other resources, and worksheets as well. You can download. And again, professionals asked for this, especially, and you can print off or work on them digitally. And it's full of GIFs as well. So we've spliced the animations to make the pages more lively and communicate the key messages as well, especially related to the self-help techniques that we've put into the program, especially in the self-help sections. And we've been working with the youth advisory group here at the Wolfson Centre to see if we're on the right lines, and for them to advise on our sort of methodology. And I've got lots of nice quotes, and this is the quote I keep getting back to. Sort of probably the first digital platform for mental health I've seen where I've thought I'm going to look that up later. This might actually help me. So, and there's a couple of other positive quotes there as well. So, as I said, we're now doing what's called a feasibility randomized control trial of the program across Wales and in Scotland as well. Now these are the posters and the postcards we've been using. Some of you might be familiar with them. I can send some to you if you like. This has been going on for about a year now. There's about a month left of recruitment. So if you are interested, please get in touch, or I'll show you. It's quite simple how to register an interest if you know of any young people who might be interested in taking part. And as I said, one way is just to give them reference to the study website, or if you'd like us to post out some postcards to give to the young people, there's information on them as well. The main aims of the study is to look at the feasibility and acceptability of the program and the methods. So by that I mean whether the program is appropriate for young people, whether it helps them, whether the methods we're using are appropriate as well. But we're also looking at other factors like whether it helps specifically with depressive or anxiety symptoms, or, for example, help-seeking behaviour. And we're recruiting young people aged 13 to 19 years old, those that are experiencing some low mood or other depressive symptoms. So it doesn't mean they don't need to be severe problems. It could be that they've been stressed, for example, with exams or going through a hard time. There is, on the study website, if they go onto that, there's a form to fill in and with questions about their mood. So that will allow us to see whether they reach the threshold. And I'll show you the study website now. It's open to anyone across Wales. So we've been advertising this through social media. They don't have to be someone registered at your school or seeing a school counsellor or seeing child and adolescent mental health services, for example. It could be anyone who finds the study online. And the parents and carers of those taking part can also take part themselves. And this is just to show how wide we've been casting the net. So we've been in touch with a lot of schools, school counsellors, primary mental health and secondary care, as well as charities and youth groups across Wales. Maybe this is a bit too much detail for some, but this is the trial flow chart. So at the top there are the settings I mentioned. So we're recruiting through schools, health services, charities, but also through social media. And then in the second box down there, we're recruiting up to 120. We're about 110 at the moment, so we're not far off, but it doesn't matter if we go over 120. And then 2/3 of young people will get access to the program. 1/3 will have access to a digital information pack, so everyone will get something. And if they get into the project, they're asked to complete questionnaires at the start, and then 2 months later, questionnaires again. And in between that time, we'll send them online resources. They don't have to talk to us. They can if they want to talk about the project. Everyone who takes part gets Love to Shop vouchers and a certificate at the end. And also they can say they've taken part in the mental health project. And that's of interest to many who, especially if they're going into psychology or some research degree. And also we're monitoring sort of web usage and doing some interviews at the end, but that's optional for people. So yeah, how to take part. So all it is really is to go on the study website. So it's ncmh.info/digital-support-study. So I can put it in the chat as well. And if you go on that, there's all the information you need on the project. There's information sheets you can download, and then a link to the form where the young person can register an interest. Parents and carers and teachers or other practitioners can also fill the form on the young person's behalf with their permission. There's a QR code there as well. You're welcome to email us at that email address, youthonlinestudy@cardiff.ac.uk, if you'd like to ask any questions. That email address is also on the study website. And that's my handle on X or Twitter. Just to mention that I've been doing a lot of promotion online. You'll find a lot of these on social media as well. And as I said, I'm happy to post out cards and posters as well. I appreciate it's only a month of recruitment, so there's that to consider. But yeah, the study website has all the information. Yeah, and a lot of people ask me, so what happens next after we finish the study? Because we're hoping to finish everything early next year. So we'll start to analyze the data and publish everything. And we'll have to decide what measures need to be taken now, whether we go on to do more evaluation and implementation work, whether it's ready to be rolled out. And I'll be going back to young people as well and talking to practitioners to decide on the next steps. We're also, it could be that if you see the program and you have any advice on content we should be adding or any design features that could be changed, then we're open to any feedback. And in the future as well, been talking about whether this could be fit into the school curriculum as part of lesson plans, and also we could make it a broader digital ecosystem for other mental health difficulties and other health difficulties. So there's a question there. Yeah, I should have said, so once you're in the project, you'll have access to the resources for at least 6 months. So even though recruitment finishes in about a month, anyone who gets in will have access to the website or the other information sheets for at least 6 months, maybe more. And everything will be functioning just as well. And I will be on hand as well to answer any questions in that period. So that's it, really. Thanks a lot to all the people who've been helping with the project, and thanks also to all the schools who are already involved, been really helpful in spreading the word. And yeah, that's the information. Again, I'll type it into the chat, and I'm happy to answer any questions or discuss anything about the project or anything mental health wise.